Joao. Thank you very much for joining us. Doctor, thank you for joining us. I will introduce myself. My name is Hannah. I'm the Director of Patient Services here at Verita Neuro, and today we will be chatting with Joao, our patient who just recently completed his epidural stimulation program, and our Medical Director, Dr. Nasir. Hello, everyone.
Yes, hello. Thank you, Hannah. Hello, Joao. Hello, everyone.
Hello.
Joao, how are you? It's been now around a little bit over a month since the treatment. Would you like to also say a few words about yourself, introduce yourself before we dig into details?
Okay, nice to meet everyone. My name is Joao. I'm from Brazil. I'm 24 years old, and I'm really happy with the Stimul epiduration. I am really focused on physiotherapy the last months, and every time I go to PT, I have more results. I don't know the potential yet, but I know it's really good. Really happy.
Very happy to hear. Doctor and Joao, maybe both of you could tell us a little bit more about the exact procedure that Joao got. Doctor, maybe you would like to elaborate a little bit more about the type of injury Joao has.
Yes, thank you for your time, Joao. So, as I think some of you may follow Joao's journey on the social media, Joao is a T9 spinal cord injury patient, which is clinically termed as a complete injury. And I think it was in 2018. It was July 2018, more than 3 years ago. And Joe had been doing extensive physiotherapy and rehabilitation since his injury. So recently, he learned about epidural spinal cord stimulation, which is our flagship treatment, and he traveled to our treatment center in Mexico recently, and he was discharged around 1 month ago after completion of the treatment. The procedure itself is basically implantation of a small neurostimulator in the spinal cord, actually slightly outside the spinal cord into a space which is called epidural space. Hence, the procedure is called epidural implantation of stimulation. In this procedure, we perform a small surgery to remove a small part of the bone, which is called lamina. The surgery is called laminectomy. It's a really small surgery to make a small drill basically into the spine and approach the spinal canal using a very minimally invasive procedure. After we approach the spinal canal into a specific location over the lumbar spinal cord, we target the basically lumbosacral spinal cord, which is responsible for muscle activity in the lower limbs. Our aim is to stimulate a specific component of the spinal cord, which is responsible for walking ability. So functionally, this part of the spinal cord is disconnected from the brain because there is an injury which is not able to transmit all the signals to the lower part. So our aim is to provide the missing kind of stimulation to this part of the spinal cord, which results in muscle contractions. So our aim is to get basically a muscle contraction in the lower limbs after the procedure. And during the recovery process, through a process which is called programming of a stimulator or mapping, we basically try to convert those muscle contractions into volitional muscle activity by very precisely stimulating those components. So Joao recently went through this procedure, and we are seeing, I think, a tremendous recovery so far. So maybe Joao would like to elaborate a little bit more for our audience.
Sure, Joao. Dr. Nasir mentioned a lot of medical details about the treatment itself, but maybe you could tell us from your side how your condition was before the treatment. Why did you decide to go ahead with the epidural stimulation, and to start it, what were your hopes and goals to achieve with this treatment?
Okay. So I have a complete injury, T9. I had no control or below my injury. I couldn't move nothing. After the epidural stimulation, like some days after, we started doing mapping, and I already got a lot of movements, much more trunk control. My goal was to walk again. My goal is to walk again, and I'm reaching it. It's a slow process, but every time in PT, I'm having more and more gains. Uh, two days ago, for the first time, I turned off the stimulator and I could stand for 3 minutes with no programs. So I think I don't know the potential yet, because every time I'm having more gains. I'm really happy with the treatment, and I don't know how far I will go, but probably I'm going really far.
Joao, I hope you don't mind. I prepared a few videos, some memories from Mexico and some of your more recent videos. I will play them now. One second. This is a video I really like. This is, I think, this is a video we took when we were around 2 weeks in the process. This is you locking your knees and training with Eliel, one of your therapists in our facility in Guadalajara. How fast did the progress come for you, and how was the mapping process for you? Did you see milestones week by week, or was it a longer process for you?
To do this, to stand before, I needed to use braces. It was impossible locking my knees. Right from the start of the mapping, I already got movements from the leg, some flexions and standing, and every day I got more and more results. By the I think it was 4 weeks maybe after surgery, I was already able to stand like that. My knees were locking really good, and each time I had more progress. The mapping was really cool, because first I didn't move my legs for 3 years, and I started moving really fast. The guys are really great. Juanito, Eliel, Daniel, everyone is really good. I make friends for life. So
it's lovely to
really
hear,
good.
and we feel the same way. And very happy with your improvements. I saw you recently shared this video with us. This is maybe a few days ago.
Yeah.
How do you feel?
Really good. This is hard yet, but it's getting much better. I'm focused on the trunk control. I think I started getting in the walker maybe 2 weeks ago, and I'm really getting big advance. Like how I was saying, every time I go to PT, I got more and more results. So it's really hard to know what to expect. But it's good.
Yes, I think I know Joao is trying to stay realistic. We all are, but I think it's safe to assume that we are seeing tremendous amount of recovery so far in just 2 months. I think since the surgery. One of the important things in Joao's case is the injury is at thoracic level. I think this also makes a difference. It's like the lower thoracic level, so it gives him a little bit better trunk control. So it's slightly easier for patients to to control their upper body and focus on the lower body. This is an important factor, but I think nonetheless it's quite amazing recovery, I would say, considering our experience with many other patients. Also, I think it's also, of course, Joao is very dedicated towards his recovery. And another thing is, since I think everyone knows, or at least many of you know, the stimulator has quite a long life expectancy. It can stay and working for many, many years, at least 9 years. So I think that's a long way to go, Joao. Hopefully, you will continue to see recovery, and hopefully we can reach a maximum possible recovery very soon.
Right. I think it's also very important to mention that, Joao, you've been very dedicated to your physical therapy, not only during your stay, which is around 4 or 5 hours a day, but also before and after your treatment, right? So this is something we always encourage our patients to take very seriously, and make sure they're receiving enough physical therapy and exercise at home, even by themselves, at least few hours a day, especially in the recovery period, which is after the surgery and after the treatment. We recommend to work hard for at least 12 months. So I think it's safe to assume that we're still in the beginning of Joao's journey. Hopefully there are many more milestones to achieve. Joao, during your treatment, could you tell us a little bit more about the whole process? How was the surgery for you, and how did your usual day look like?
Okay, the surgery was for me was simple. Like the recovery was really fast. I spent 1 week recovering from the epidural stimulation surgery, and 1 week for the stem cells. I didn't felt a lot of pain. And you're saying from the physiotherapy, like when I got the injury, I focused on getting ready for when I had a cur or something to try, and that really helped me for going for the rehab.
Mm-hmm. How do you think, if someone is considering this treatment, what would be your recommendation? How to prepare yourself and how to get ready? What all did you do?
I think it's nice if you're training a little bit before, so you're already used to some training, because it's like really hard work. The physiotherapies, it's 5 hours a day,
Yes. Mm-hmm.
so it's not easy. Like sometimes you're tired, but I was always thinking of the bigger picture. Like I really wanted to get the best results as I could, the best programs, more functional. And how you said and said, every day I'm getting more and more results. I don't know where I'm going, but I'm really happy with the results.
Mm-hmm. You mentioned you also received the stem cell treatment. Doctor, maybe you could explain why this is something that is important for us to incorporate as a part of the treatment plan, and
Right.
what we can expect from that.
So the epidural stimulation is primarily to target the motor function, because it is basically used to stimulate a big network of like motor nerves in the lumbar spinal cord. It doesn't really do much for the sensory function and some of the other functions which are lost after the injury. So stem cell treatment we combine as a way to basically complement the epidural stimulation and also target other missing components, particularly the sensory function. The major mechanism by which stem cells act is through their anti-inflammatory properties. So they are able to basically reduce the inflammatory response against the injury, which is an important hurdle against the recovery. So once we see a reduction in the inflammation, our spinal cord can retain natural potential to recover itself. So then you combine this with extensive physiotherapy, then patients may see more regeneration, particularly in their sensory function and also in their bladder and bowel functions. I think in Joao's case, it may be slightly early, bit earlier to expect significant changes, but maybe Joao can elaborate a little bit if he's also seeing changes in the sensory function.
I think the stem cells is a really important part of the treatment. Like you said, didn't have much results yet, but I feel my sensibility going down. I can feel a little bit more my abs and my back, my lower back.
Yeah, I think this is a good sign. If we are seeing a little bit of sensory function coming down, normally, it doesn't really happen dramatically. All the functions but we normally start to see a little bit more feelings coming down below the level of injury. So injury starts to move a little bit downwards, and also this can open a way for us to perform another treatment in the future. So I think with more stem cell injections in the future, with extensive physiotherapy and the stimulation, we also hope to see a certain level of recovery in the sensory function and in the bladder and bowel functions.
Today, just before the call, Joao mentioned to me when we were just catching up before the webinar, he mentioned to me that he's so encouraged with his results so far. He's actually considering to come back for more mapping. So I think it's an interesting conversation that we started. So what we were discussing is that, yes, of course, physical therapy is important. However, the additional mapping of the stimulator will not be necessary for at least a good few months, maybe 6 to even 12 months. So as much as it's a very complicated process and it takes time to complete programming of all of the necessary settings of the device to address all of the functions that we would like to see, it will last for a good period of time to give Joao time to also work on those improvements and continue to build the muscle mass and muscle strength. Doctor, would you like to say a little bit more about mapping? I know many of the people who are contacting us there maybe don't understand how mapping exactly works, what is it for, and why is it not it's not a constant process. However, it will probably need to be repeated in the future.
Yes. So implantation of the electrical stimulation is one thing, but mapping is a way to basically operate the stimulator at very precise electrical currents and intensities. So during the surgery, we implant a chip of what is called 16 pedal electrodes. So there are 16 small contacts in a long embedded chip, which is implanted into the epidural space. So each contact represents a specific location in the spinal cord, and this specific location represents a specific muscle group. So basically, our aim is to use those electrodes to precisely stimulate various muscle groups. And then once we, for example, using a couple of electrodes on the top, we can maybe able to see hip flexors on both sides, just as an example. And on the lower muscles, maybe we muscles, and then combine those muscles into single programs. So the ultimate aim is to get what we call a walking program, basically a program which is stimulating majority of the muscles required for patients to walk, right? So so we start with the simple muscle groups, keep combining them into more complex programs, and ultimately this leads to a complex or the final program, which is the stepping program. The stepping program is then used for patients during the training process. So basically, when this program is turned on, it is stimulating the muscles in the legs required for walking, and then patients can train. So it can, over time, it can improve their walking ability. So this is the whole concept behind the mapping. Of course, without mapping, the stimulator itself is basically nothing. And also the reason we mentioned patients may need more mapping is actually once we give stimulation to the spinal cord, it kind of results in more dynamic state of, so spinal cord becomes a little bit more dynamic. Even after many years of injury, the spinal cord still retains some potential to recover. So after the implantation, as a result of the electrical stimulation, it starts to produce what is called neuroplasticity. And once during the next 6 months or 1 year, we see a lot of neuroplasticity. This means that the mapping parameters may not be compatible with the new kind of pathways in the spinal cord as a result of neuroplasticity. So we also have to use more. We have to do remapping in those patients after some time, which is not a bad thing. Actually, it's a positive thing. It means that we had moved to an advanced level, and hence we have to maybe reduce the electrical intensities in some cases.
Joao, so for your daily exercise and your daily life right now, what all programs do you have and what programs do you use?
I have some programs for leg work, like extensions, some for glute stimulation, and I have a lot for walking and standing programs. I have some for trunk control that I think that's really good, that you can use every day for daily activities, like doing dishes, driving. The ones that I most like are the walking and the standing one. I use whatever I can, sometimes friends at barbecue or going out. About remapping too, I want to say that it's a good thing. Like it's a door that's always open. You can do it and get
Absolutely.
more function programs and better. So it's a good thing. You always have more chances to get better.
Right. So, Joao, sometimes, if you don't know a lot of details about the stimulator itself, many people are asking us, how does it work? We know that you have a remote control that you're using to switch the programs, but I think it's important to mention against the common misconception that you just press a button and you start to walk, right? So, how do you operate your programs and how do you operate your stimulator?
So
I think what I want to say is that maybe highlight the fact that those movements are voluntary movements that we are talking about, right? So it's not as simple, right? It requires a lot of brain-body coordination as well.
Yeah, so you have the control. You're gonna activate the standing program, for example, or let's say standing standing the right leg. I will turn on, put in the right intensity. But if I don't send the information, it won't work. Like it's not automatic. I need to find the right information, the right positioning to send the information so it passes. Isn't like a robot. It's you sending the information.
From your own mind in a way, right?
Yeah, and it's
Mm-hmm.
hard.
It is, right? Because in a way you have to think about moving in a certain way for it to happen, right?
Yeah,
Is
you have
this
the right
this is a
information.
good description?
Yeah, perfect.
Mm-hmm. Okay. Okay. Joao, for with the surgery, of course, there are some side effects, right? We know one of the most common side effects is, of course, maybe not common, but most significant one is a possible infection. We don't see it often. Actually, we see this very rarely. We didn't see in your case, and neither with any other patients for the longest time. But did you see any other side effects like increased spasticity or maybe some neuropathic pain?
I got more specificity, especially in the morning. I have a program that it's for sleeping, that we turn all the electrodes and you go circles in my injury. I don't know if it's maybe that, but when I wake up, I have more spasm. But that's the only side effect. And actually, it helps me sometimes in physiotherapy. Uh, like I said, I think some time ago, the first time I could stand without a program, maybe was one of the reason was spasm too.
Mm-hmm. I think spasticity is definitely a good sign. I will ask Dr. Nasir to explain a little bit more to us about why it happens and what does it mean. But I think, yes, it's important to know that, yes, it's helping you to a certain extent, but hopefully within the next few months, it should go back to the regular levels. Doctor, you recently
Shows there are certain residual spinal pathways being functional. So after spinal cord injury, there are always some intact pathways, which in most of the cases are non-functional. So as a result of the electrical stimulation and the stem cell treatment, those pathways become more and more functional. So basically, spasticity is a feature of an incomplete lesion rather than a complete spinal cord injury. After a complete surgery, complete injury, if we start to see more spasticity, this means that more and more spinal pathways are being functional. So this is, I think, happening in Joao's case, and it does happen in most of the patients, majority of the patients they see. And this is actually something we expect to see, and this is what is the first step towards regaining volitional muscle control or permanent natural recovery. So it's definitely, I understand for some patients it may bother them, but it's definitely a positive sign after a severe spinal cord injury. And in majority of patients, in our experience, we see the spasticity being regulated after a certain amount of time. It does not stay persistent for majority of the patients. The stimulator itself starts to regulate those pathways and starts to regulate the muscle tone.
Mm-hmm. Joao, one thing that I find interesting that you mentioned to us today is that recently you even tried to switch off the stimulator while in your physio, right? And you were able to perform certain movements.
Yeah, I could lock my knee. Was for like some 3 minutes. We're trying this for some time to see the results and to stimulate without the programs. I expect in long terms, I will gain more voluntary movements without the stimulator.
Mm-hmm. Doctor, is this something you commonly see in your patients? Usually I know this happens later than in Joao's case, but I think it's a very interesting phenomenon worth mentioning.
Right. So there are, I think, two possible reasons. I think in Joao's case, it's probably both. One is the stem cell treatment, which produces some regeneration of the spinal pathways, so it produces more permanent type of recovery. The second is the epidural stimulation results in rearrangement of spinal pathways. So I think both epidural stimulation and the stem cell treatment can contribute towards more permanent recovery in spinal cord injury patients. So initially, we see patients have to use the stimulator, but after some time, some patients can perform some function without the use of the stimulator. The only explanation is the stimulator results in basically regeneration of the spinal cord. So we hope in many patients after many years we may see more permanent recovery, like Joao is expecting to happen.
Mm-hmm. I just wanted to inform everyone who joined us that we are most welcome to ask questions. If you would like to send some questions to Joao or to Doctor, now is the right time. We will try to address all of them and answer your questions about the treatment itself. About Joao will be happy to answer about his experience. So please don't be shy and share your questions and comment with us through Zoom and through the Facebook Live that we're also at. Doctor, in the meantime, maybe you can tell us a little bit more in terms of future expectations. What do we hope to see, and how do you think the recovery will look like?
I think the expectations are to be able to walk with the upper body support, like an incomplete spinal cord injury patient. So this is, I think Joao and we share the common goal, common expectations, and I have no reason to doubt this will not happen. I think this is definitely something will happen with long-term commitment, of course. So this is the goal after the implantation in many of the patients. Of course, every patient is different. We cannot expect same kind of recovery in everyone, but many patients find it extremely beneficial to use the stimulator. Another thing is from the stem cell treatment, we hope to see some recovery of the sensory function, which will automatically improve the motor function also. And it gives what is called proprioception. Patients regain ability to feel their muscles, so their muscle placement is better over time. And another thing will be to see changes in the bladder and bowel functions. Hopefully, Joao will be able to regain certain level of control over those last functions. And then many patients, they find the stimulator very useful to manage their nerve pain, and the spasms or spasticity, as well as blood pressure regulation can be improved.
Mm-hmm. And we are hoping to see this for you, Joao, and we hope to see those improvements in all of our patients who are coming to us, both in Thailand and Mexico, our 2 locations. One more question I wanted to ask Joao is, just from your experience being in the clinic in Mexico, did the whole stay go as you expected, or was your idea of how it's going to be a little bit different than what it is in real life?
My experience was really positive, and I didn't know really what to expect. I didn't know how it would be like mapping and staying out of my country for some long time, but it was really good. Like everyone is really friendly. People in Mexico generally, everybody, like if I needed help, they were there, and it passed really fast for me. Like it was so good. I could stay some weeks more.
Okay, so you did not miss home. You were actually, the time flew, right, during
Yeah.
the stay. Okay, that's very nice to hear. Doctor, we have one question from Miha B. He's asking us, what are the expected levels of sensory recovery? And he's sending greetings from Slovenia. Thank you very much, Miha. We're sending also greetings from Thailand and Brazil.
I think the recovery in the sensory function is, generally speaking, not as because it cannot be directly targeted. For the motor function, it's the epidural stimulation does target the motor function. The recovery in sensory function, it depends on the injury. So if there is no transaction of the spinal cord, no major disruption of the spinal cord, then the stem cell treatment can restore some of the lost pathways integrity, which can improve the sensory function. It's very difficult to put this into like percentage, but it all depends on how severe the injury is at the time of the treatment. Sorry, I think we'll ask you. Oh, okay.
Sorry, thank you, doctor. I see there are some more questions we received from the Facebook live page. So the first question is about the success rate of epidural stimulation. Doctor, could you elaborate?
We see certain level of recovery in majority of our patients, and we of course spend a significant amount of time going through all the information and communicating with the patient. For patients we have treated, for majority of the patients we have seen certain level of recovery. Patients with the recent injuries normally see, of course, faster and better recovery as compared to patients with very old injuries. So there is no single answer about the success rate. I think it depends on each individual patient in terms of the percentage of recovery. But I think the bottom line is majority of the patients we have treated see very reasonable recovery in their functions.
There's also one question about the bowel and bladder control. The question is from Jose Sam. He's asking if the nerves do come back and how the control of bowel and bladder is, what is the goal in those areas? Yeah,
for the bowel function, we can stimulate the abdominal muscles, which can improve the mobility of the GI tract. So this can reduce the time period required for bowel evacuation. Many patients can do bowel routine without requiring suppositories or manual stimulation because of the increased overall mobility, increased muscle function, the trunk area. For the bladder function, the stimulator can help with the bladder capacity. Many patients, they have severe bladder spasms. The bladder gets basically, it shrinks over time. And the stimulator can relax the bladder, which itself is a big muscle, and it can accommodate larger quantities of urine. Over time, some patients, they regain control. They are able to push the urine out to some extent, and able to have certain level of control over their bladder function.
Okay, another question is from Susan. Asking about her condition. So she has T78 and T12 injury. Is this something we could treat, doctor?
T8, T9, definitely yes, but for T12 we have to see the MRI scan. basically the T12 injury main valve part of the spinal cord we intend to stimulate. So we basically stimulate the lumbar spinal cord, which is located at this level actually, in front of T12 vertebral body. So if that specific part is, because that's also the last part of the spinal cord. So if that specific part is injured, then it may not be possible for us to implant the stimulator. But if the injury is slightly above and it gives us around 6 or 7 centimeters of the intact spinal cord below the level of injury, then we can actually implant the stimulator, and we are expecting a good recovery. So it depends on the MRI scan findings.
Sure. I think other than epidural stimulation, we do have many treatment options available. So it's always good to get in touch and get evaluated for some of the treatments. So hopefully there will be a way for us to help. We have one more question from Miss Anna. She's saying she has a rare illness. It's called syringomyelia, and she needs a morphine pump for pain. So Anna, usually, especially for this treatment that we are discussing today, we're usually treating spinal cord injury patients, usually traumatic injuries. So the ultimate goal is to regain the voluntary movements and the lost functions lost as a result of an accident. So pain itself, it's not something that we treat with the stimulator. However, if there are more details, we will definitely take a look at your medical files to see if there is anything you could do with us or conventionally that could help you. We have someone from Portugal asking about treatment for T11. So I think that the answer is the same. A lot depends on the MRI scan. So Joachim, please contact us. We will review the MRI and we will let you know what can be done in your case. There are no more questions. Joao, it was such a pleasure to see you today, and thank you for joining us. We wish you all the best. Both the Thailand and Mexico team are cheering for you, and please keep us updated. If there is anything you would like to say to anyone considering this treatment, I think please go ahead and share your message.
Thank you. For everyone considering doing the treatment, I think it's a really good idea. I got many results in less than 3 months, and I'm expecting big results for this year. I think it opens a big door that you can always get better. And if you have any question, you can email me, text me. I'll be happy to help anyone.
Thank you very much. Doctor, is there anything you would like to add from your side?
No, I think we are open to see if there is anyone interested in the treatment. We will be happy to have a proper medical evaluation and one-on-one discussion to see if someone qualifies for this kind of treatment. It's definitely, I think, one of the most advanced options available for spinal cord injury patients, and it is definitely something worth considering. And many patients can benefit from this kind of treatment.
Most definitely. You can reach out to us through our social media at Epidural Stimulation now, and one of our specialists will be in touch with you. Joao also is happy to talk to whoever is considering this. So thank you for that, Joao, and thank you, Dr. Nasir. Thank you both for your time, and both have a very good day.
Yes, thank you very much, Joao. Thank you.
Bye, Joao. Lovely seeing you.
Bye.
Bye.